I'm Dr. Edward Kammerer, Chief Medical Officer and Chief Quality Officer for Mosaic Health Systems. Today I'd like to take the opportunity to discuss with you the current COVID situation. As it stands today, we're seeing record numbers with over 3,600 tests performed last week and 1,200 positives. This has created a significant bottleneck inside of our community with regards to access to care. So in that venue, we're still here for you. We want to make sure that you understand that Mosaic is here and ready. We have the appropriate staff, we have the appropriate people in place, but we need to make sure that we get to the right location. What we're asking of the public today is to try to access your primary care first, and if you have COVID-like symptoms, in order to help disperse that care. The urgent care is open, the hours of operation are what they have been in the past, and they continue to be very functional. Our emergency room also is open 24 hours a day, 7 days a week. However, they are very busy there. In this setting, it is best to access your primary care first and ultimately try to get the testing as an outpatient. With this, we also expect that testing to be delayed. We've had a significant increase in the number of tests that we order per week, and we're had to utilize some of the send-out tests now instead of all the rapid tests that we had been running before. Our supplies are adequate, but not exceptional. So at this point in time, it may take a period of a day or two to get your test results back. Please be patient with us and quarantine during that time. Right now, we're also seeing the start of the flu season. We've had increasing numbers of flu, RSV, as well as COVID. These things can be very similar, especially if you've been vaccinated. So if you've been vaccinated and you have symptoms of the flu or COVID, it may also be RSV. That being said, the quarantine and the measures taken for all of these diseases are the same. What we'd ask you to do is to use anti-inflammatories, antipyretics, as dictated by your pediatrician or your provider, if you can, and to make sure that you quarantine yourself at home. Again, each of these diseases has the same process and they look very similar, so a test is what we use to delineate whether you have RSV, influenza, or COVID. Appropriate care, once the test is back, will be further delineated by your provider. In addition, what we're seeing today is we're seeing mostly unvaccinated people. In our hospital, that constitutes 80% of our people who are hospitalized. And with regards to our testing outside, we're seeing, again, mostly this is an unvaccinated disease. Nonetheless, there are certainly breakthrough cases, especially if you've not had your booster. I would take this opportunity to redo the math, to look at this again and consider the possibility of taking your vaccination. Clearly, those who are vaccinated are much less likely to be hospitalized, they're much less likely to end up on a ventilator, and their mortality is much better. Please understand that we have an extensive wait at both the urgent care as well as the emergency room. As such, once again, we'd advocate that you consider contacting your primary care office during normal operating hours, and we've actually extended our primary care offices hours in many locations. This should improve access as well. Please reach out to your primary care before accessing the urgent care or the emergency room if at all possible. In addition, I want to take the opportunity to thank our caregivers who are fighting like a team through this whole endeavor. Once again, we've stepped up to the plate. Our caregivers have done a yeoman's job of coming forward and making sure that they are able to provide the right care at the right place at the right time. As we continue with these efforts, please be patient. And again, thank you to our team. As we go on, we'll fight like a team and we'll win this battle.